Hello friends, in the fifth week of the certificate course of palliative care, we are going to discuss about the symptom management in palliative care. The patients have variety of symptoms which creates a distress, discomfort, and is trauma, stress, mental stress in the patients. So symptom management is very important. We are going to talk about that in this week, the use of the kitchen spices for symptom management, integrative approach to managing dementia, delirium, and seizure with a special reference to the Indian spices and herbal treatment and Panchkarma therapy. All the dimensions of Ayurveda will be discussed in this week. And safety and accessibility of the palliative care to all the patients will be discussed. How it can, accessibility of the palliative care services can be given to each and every person who needs it without much financial burden. That is our aim to discuss. The healing through kitchen spices, the Triphala, detox, immunity, digestion, Trikutu, and other churnas, all details will be discussed in this. The therapeutic use of spices in the pain management, in the cough, anxiety, and GI problem, and in doses and formulations of these medicines will be discussed. And scientific validation and clinical relevance of the use of these things in Ayurveda with reference to palliative care will also be discussed in this. The neurocognitive symptom management is another important aspect which we are going to talk in this week. Dementia, cognitive decline, and caregiver role, delirium, acute confusion, reversible causes, and seizures, recognition, Ayurvedic, neurotonic, emergency response. These things will be discussed. So more specifically, there are the 4 titles which we are going to take up this week. Basically, there will be 5 lectures in this week. Panchkarma therapy in palliative care, stress, depression, anxiety assessment in the palliative care. What is the method of assessment, the level of anxiety, level of stress, level of depression in the patient or in the caregiver family? And you have to evaluate it. Once you evaluate it, then only you can design the action for the family and the patient. And another topic is the management of dementia and delirium in palliative care. And 4th topic is the management of seizure in palliative care. Next, sleep management in palliative care. With these words, our main goal of this week is to reduce the suffering and restore the dignity of the patient and support patients and family with holistic solutions and use tradition, science, and compassion together for the benefit of the patient. Let us begin with this class, this 5th week. Thank you very much.